Good Thursday afternoon. My name is Nathan Thompson with the Rapid City Journal, and welcome to this edition of City Beat, brought to you by the Journal and in partnership with the City of Rapid City. We've been on a little bit of a hiatus here at the tail end of the summer, so we're coming back to you live today and talking about things that are going on within the City of Rapid City. And some of the things that are going on right now. We're in the middle of budget discussions. We are in the middle of looking at where vision funds are going to be going for future community projects across the area. And of course, the medical marijuana initiatives that are legal in the state, but there's no framework behind it. So city governments are going in and looking at those different things that can be done to help regulate the medical marijuana industry here in Rapid City and in the state of South Dakota. And to help us with understanding a lot of these complexities that are going on within our government in the city, we have Mayor Steve Allender with us today. Mayor, how are you today?
Doing well today. It's another nice summer day out, so I'm doing well.
Yeah, getting ready for that,
Yep.
that autumnal time to come. I've already changed some of the decorations in my home, so I'm ready for it, ready for some of those cooler temperatures and hopefully some moisture in the air as
Yep.
well. So lots of things are going on, Mayor. And while we're here live, ladies and gentlemen, if you have any questions that you would like to ask Mayor Allender, you may do so in the comments below. And during our program, if we have any time, I'll be sure to go in and ask as many of those questions as possible that we can do. But again, Mayor, some of the things that the government, municipal government is looking at right now, it's talking about the budget process. So let's kind of start with that. How are we doing? You proposed your budget a few weeks ago. Council has gone through with first reading. Second reading needs to be done before the beginning of October. So where are we in that particular process right now, Mayor?
Well, 2 nights ago, the City Council voted to approve the first reading of the appropriation ordinance. That's the budget ordinance. So looks like we're well on our way to getting an approval here on the 20th at the next City Council meeting. So the budget process is really an elongated process that starts quietly behind the scenes, clear back in February of one year, and it really starts to get involved around May and June. And then for me, the time is mainly July and August when that really becomes a chore that has to be completed. And so this year we went through that again, and I think we made a good budget proposal that will address the rapid growth that we're having in the city and also some major problems that are needing addressed, and the council seems to be okay with it at this point.
And some of those initiatives, Mayor, that have been talked about are some of the concerns related to those who are without homes, the homeless folks within our population. And you have proposed some brave new, I must say, programs to address some of those homeless issues. So give a little bit of background. I know you've talked about it extensively at council meetings and in other public forums. So talk a little bit about what the city is looking to do to address the concerns within the homeless population.
Well, homelessness has increased in Rapid City, and between all the federal organizations, there's many different ways to count who is homeless. And so the homeless count numbers are very elevated because they count everyone in jails and shelters and living with relatives and that sort of thing. But when I refer to homeless, I'm referring to the people who are sleeping outside, walking around during the day with nowhere to go, those that you might find panhandling or taking naps in the park, that type of thing. So that number of homeless has increased dramatically over the last year and a half. And so that brings with it some issues. Also, what's changed in the last year and a half is our ability to make controversial everything. We can find fault everywhere. So So there's a long-running phenomenon in the background, and that is law enforcement being the primary caregiver for the homeless. So that's always been inappropriate. The homeless don't always commit crimes. In fact, they rarely commit crimes. Their issues are more related to addiction and mental health or other barriers to keeping them from success. So, but we've gotten away with it for a long time. Then in 2013, the state passed a bill to start to reform the criminal justice system. And from that, there's been a large priority, a huge priority to get the police in a position where they no longer focus on minor crimes committed by indigent people. So drinking in public and urinating in public and these type of things. And you know, having been there, I'll tell you that when that's the only tool to use, you use it. And that's always been the problem. So government, and here especially in the land of conservatism, we want to keep government small and we want everybody to make their own way and all that. And I agree with that, by the way. However, we have this group of homeless that is taking an inordinate number of resources and they're not being positively affected by it. So I estimate that a minimum of $15 million annually currently is being spent on trying to mitigate the homeless situation in Rapid City with very little effect. Mm-hmm. And that's government money, $15 million, taxpayer money. So we are proposing to start probably what is a multi-year plan to get the homeless service priority out from under law enforcement to let the police start policing again. And at this point in time, this summer, the calls for service related to homelessness and poverty-related issues took up about 65% of the RCPD time. Mm-hmm. And they have a large budget, they have a lot of resources, but they can't keep up with what's going on. So in the budget, we've proposed to start out small, contracting with a few local nonprofits to provide essential services to the homeless. And when I say that, I'm not talking about food and shelter. I'm talking about case management, connection with already existing services, emergency housing for some who qualify, and those sorts of services, because that's what's lacking right now. That's what the police can't do. And so this is only a few $100,000 that is going to go to this, and I believe we need a homeless coordinator position or a homeless program manager to pull all these programs together, all these efforts together. But ultimately the goal is to get homeless services away from law enforcement and fire and put them where they belong in a social service framework. And by the way, this is not something that will make being homeless more attractive for people. We're not making homeless life easier or more glamorous. We're not providing the type of services that may attract more individuals. We're proposing to try to determine who among our homeless population can be helped and who can't. And for the group within the group that can be helped, that will accept treatment or assistance, and we refer to them as the unwilling homeless, we think this could be a very beneficial prospect.
And some of the discussion, at least on the micro level of city budget, obviously we're looking at big picture here on the macro level, that there is a solution being offered, a possible solution to see if this program works. On the micro level, whenever you look at the accounting, basically, much of that budget for your proposal was going to be under the mayor's budget, basically. And then there were going to be some additional funds that were going to be sent to the public safety portion of the city budget. I think there was a request at a recent council meeting that the homeless portion of this budget be moved over to public safety. Has that been done? Is that something that should be done? What are your thoughts about where this budget line item should fall?
Well, good question. That's something that probably should not be done, but something that will be done.
Okay.
And I think there's a bit of discomfort with that money being in the mayor's office, and I don't fully understand why. But with the long-term goal being getting this service away from law enforcement, it doesn't make sense to me to put more money in the law enforcement budget to do it. But this is, as I said, a multi-year strategy. So somewhere down the road, we can worry about who pays the bills and who gets the invoices and that type of thing. That's a relatively minor situation that doesn't really need any argument at this point.
And again, we're here live with Mayor Steve Allender here on City Beat. And again, I encourage you, if you have any questions for the mayor related to city government, please do so in the comments below. And again, if we have time remaining, then we'll be sure to ask some of those questions that you may have. I'm monitoring the comments right now, so ask away. This is your chance to ask some questions to the mayor. We want to take advantage of that. So again, other parts of city government are coming together right now. A big topic being medical marijuana and the dispensaries. There was a bit of difference of opinion, let's say, on city council related to the amount of licenses that the city would be offering. There was a motion that was made, from my understanding, to increase more than double the amount of licenses that would be available in the city.
Right.
It ended up, I think, in a 4-4 tie, and that's whenever the mayor had to step in and make a decision. And you voted against increasing those licenses for dispensaries. So talk a bit, I know you have very strong feelings on this, Mayor. Talk about the licenses, why you made that decision, and your reasoning behind that.
Well, there's a lot of confusion around the marijuana policy framework right now. The state summer legislative study is not complete yet. The state is getting ready to propose rule changes. We've gotten our first preview of those potential rule changes today or late last night. And so, meanwhile, cities are having to act with city ordinances to be ready for the changes to go into effect about the middle of October. Cities have to be about, I don't know, 40 or 50 days, have a head start of 40 or 50 days on this to have local legislation drafted, to get it onto city council agendas, to have it read at 2 city council agendas, and then wait an additional 20 days after the publication of that to become a rule. So we're kind of all working with the belief that we're doing the right thing at this point. So if the state's laws and rules were clearly established today, we could do a more accurate job of anticipating what the demands are from the state. So anyway, this council, with the help of the city attorney's office, has done some work and deliberating, also with the help of the planning department, has done some deliberating on how many dispensaries is appropriate. And they came up with 15 based on some criteria similar to how many pharmacies are in the city and that sort of thing. So they came up with a 1 in 5,000 population or something of that nature, and they set that cap at 15. Well, at the council meeting 2 nights ago, then we had a consultant and we had a citizen talking about the unfairness of a cap and that the free market ought to decide, and so on and so forth. Well, I appreciate all that because I'm a free market person as well. However, everything that was said at that meeting was to support the best interest of the marijuana industry. And frankly, I'm not very concerned with the well-being of the marijuana industry. I'm more concerned with the overall health and quality of life within the city. That may sound contradictory because of the effects or benefits of medical marijuana, but it's not contradictory. What I'm saying is the citizens pretty clearly don't want a pot shop on every street corner, and they don't want to smell marijuana when they have their window open at night. And as we have seen with several other states, medical marijuana is always quickly manipulated to turn into another form of recreational marijuana. So starting out, all the rules are very well intended, and it's a kind of a sterile system. Must be a South Dakota doctor who prescribes. The marijuana can only be obtained this certain way. It can only be sold, packaged, whatever, all that kind of stuff. But in a year, we'll have literally have doctors renting a cheap motel room or taking up space in a strip mall, and that's all they do is listen to 18-year-olds say, I have glaucoma or I have chronic pain or whatever else, when realistically the lobbying effort is centered on the elderly cancer victim who has no appetite, who has chronic pain, the anxiety victim. There's a lot of legitimate issues that come with that lobbying campaign. But the marijuana lobby is possibly the most well-organized and well-funded lobby in this nation, and it's been in existence for decades. And this was always a slow plan for that lobby to get marijuana in every community. So we're trying to adapt with what's inevitably happening. We're trying to adapt with the necessary rules to protect us. So on a whim, some of the city council decided we need to really change the rules midstream on how many dispensaries we're going to have. And so I thought 15 was a lot, but the city council is the policy-making board of the city. I thought 15 was a lot. Sioux Falls just voted on 5. There are some cities that are voting on 2. So I think it's always best to put your toe in the water first, to check the temperature, to find out if you're going in the right direction. So there was a motion. The motion ended up being to change from 15 dispensaries to 37. And so I couldn't take that based on the logic that there'd been some work and research into getting to 15. Plus, it's highly controversial, and I don't think half of the council should be deciding on a highly controversial issue. So my vote is typically going to be no in that sense.
And
so
it was similar to whenever, during the winter months, during the mask mandate debate
Yeah.
as well. It was a divided council, and you with much thought, went and voted against that. So
Right.
Is that the same mindset?
It's the same mindset, and nobody tells you how to do this. Nobody tells you what the criteria should be for a mayor breaking a tie. But I want a controversial action or an important, impactful action to be passed by the majority of the city council, not half of them. And there's plenty of examples of us being divided. I don't want the city council to be one of the primary ones. So.
Well, and again, something else to understand is that an ordinance can be amended in time.
Oh, yeah.
So if we see that there's a business demand, or we have better framework, and there needs to be adjustments in the city to how many licenses the city issues for this particular issue, future city councils, future mayors can make that decision.
Absolutely. You can easily go from 15 to 37 in the future. You cannot easily go from 37 to 15.
Right.
And free market or not, this is a big issue for our communities. And I think we should be operating carefully. Now, someone at the council meeting brought up video lottery. Oh, this is just like video lottery. In the beginning, there were one on every corner, and now it's kind of settled down. Well, that's kind of a poor example, because video lottery is just another example of something that's approved by the voters that comes with tremendous expense to the taxpayers. Somebody gets the money from video lottery. The business owners, the state, there's a number of people who benefit from that. But who pays is every single taxpayer across the state. They pay for the law enforcement, for the dysfunction, the broken families. I've seen it firsthand, how video lottery has changed things. Now we're going to see how marijuana changes it. It's not an uneducated guess how it's going to change it. We can look at all the other states before us and get an idea how it's going to stay. It's going to put tremendous strain on the mental health systems in our community. Now, if you're pro-marijuana, you flat don't believe that. You don't think that's true. You think that's hype or some kind of paranoia. It's a documented fact that this causes things. And who pays? We all pay. It's going to cost more in law enforcement. The traffic safety is going to take a dip. There's going to be a lot of things. Maybe it's as people are adjusting to marijuana. But guess what? Someone turns 18 every day. There's always going to be someone adjusting to marijuana. So it's really, we just have to understand what we're doing and be willing to pay for it. There's no free lunch. Marijuana is not a free lunch. It comes with costs, and those costs are going to be borne by the taxpayer.
While we were talking, we've had some comments
Okay.
that have come in. Just a couple of comments and actually a couple of questions here. Pat Harwood, the second, made 2 comments. Don't want to smell marijuana every night, but hey, fire pit smoke is just fine. So, there we go. Also asked a question, how many places sell cigarettes or liquor? Pretty sure it's more than 15. And
Sure.
Another one, you do know that people smoking marijuana already do so, right?
Yeah, absolutely, absolutely. And there's a fallacy that these 15 dispensaries are going to be the only place people get marijuana. They're getting it now. And in fact, in some of the states we've seen where the marijuana becomes regulated, there's more storefront overhead, this type of thing. It's actually enhanced the black market marijuana. And Pat, I agree with you about the smoke. But that's a good example of how a citizen government could potentially come together and decide we don't want this for our community, petition your city council members, and really send the message that we want this regulated. Of course, we live in an environment where government regulation is seen as a flaw rather than an attribute. So that's going to be a little bit challenging. But I agree, more alcohol and cigarettes, that's absolutely true. And the more alcohol and cigarettes that are purchased and consumed, the more that are abused, the more that taxpayers pay the bill on it. Of course, there was an attempt to do away with alcohol back in the old days, and,
Right.
and it would be worse today to do that. But so we keep creating over time, this illustrates a point, we keep creating things that have a perceived value without understanding the cost of these things. Alcohol has a tremendous cost to the taxpayers. In fact, if there were no such thing, this is a fantasy, I'm not proposing this, if there were no such thing as alcohol or drugs, we probably have 10 people working on our police department and probably have half of the paramedics we have, and our hospital would be a one-room building. There is tremendous health effects for all of these things that are perceived as good. So all I'm saying is be prepared for the costs, because they'll come.
And then I want to make sure we get another question in here from one of our viewers. This is going back on the topic of the homeless initiative that you were proposing under your budget. Josh Stark is asking, how about build tiny houses for homeless veterans? That was a question that Josh asked. Would that be, what are your thoughts on that?
It would be perfectly acceptable. In fact, since I've taken office 6 years ago, we have adjusted some of the planning and zoning requirements to allow tiny homes. I have personally viewed tiny home examples of a veteran village that I believe is in Kansas City, might be Kansas City, Kansas, but some very well-established veteran homes. The issue is here, someone has to pay for it. And with the land acquisition, with the infrastructure, with the construction of these tiny homes, it'll be significant. So typically when that happens, there's an organization, it could be the Veterans of Foreign Wars or some other benevolent organization would come together with philanthropy and start this project. We'd be fully in support of doing that because that's a piece of the puzzle, but this is a 1,000-piece puzzle. So I'm all for it, and I would, be 100% behind it.
Well, and Mayor, we're going a little long on time here. I hope.
I'm okay.
Okay, good. Well, we'll just continue here then. I do want to talk a little bit about something that is on everybody's mind, and unfortunately,
Male pattern baldness?
Yeah. I'm showing it right now.
Yeah.
In fact, that's just the way it is. Where I look at myself on camera, like, oh my goodness. But anyway, we've had unfortunately a resurgence of this virus, the coronavirus, the COVID-19. This is a highly debated topic within our community. We're having, we just reported today, Mayor, that Pennington County is at the highest level of COVID-19 infections since prior to Thanksgiving of last year.
Yeah.
The resurgence of COVID, what are your thoughts on vaccinations, precautions? What are your views on the current pandemic?
Well, the whole thing is unfortunate, obviously. So I view it personally as two phases of this pandemic. The initial phase, starting in February, March of 2020, that seemed like every other news headline where something bad's happening somewhere else. So in the beginning, there was much mystery about the pandemic, and there was a lot of predictions, and some of them very dire. And so within a few months, it was predicted early on that about 70% of us would get this virus, and 10% of us would be dead, and so 80 or 90,000 South Dakotans would be dead, and so this, that was it. It was the threat. Now what do we do about it? We turn to public health. Public health is giving us data. They're giving us all the same advice of the CDC and everything else. Wash your hands and wear a mask and stay away from people and that sort of thing. So to flash forward, we went through that first phase. A couple thousand South Dakotans died, and everything was looking good early summer. Then the Delta variant comes. So there's less mystery with this next phase. We know more. The cumulative knowledge of the virus is greater today than it was a year ago. So we know more what to expect. And that goes in two major areas. One is we know more what to expect about the virus, about getting sick and how to behave, how to protect yourself. But also we know today how to predict the people's reaction to the pandemic, and specifically the people's reaction to any mitigation of the pandemic. It's been sharply divided between either, it's been divided and right down party lines, essentially. You've got everyone on the right side of politics, on the far right, who believes one thing, everyone on the left believes the other, and then there's a few stragglers in the middle who now are really hated by both sides because they're not taking a stand. So there's a lot of personal attacks and a lot of shaming that goes on with this. It's been very disrupted behavior, and it's just hard to navigate. So that mentality of being divided and being angry and having a desire for everyone to know your opinion, and I did my own research, and this is what's going to happen. So that's been very sad for our communities, because we are displaying that behavior in other non-pandemic areas, such as government looking at a new style of management or whatever the case is. It's all, the same groups are all ready to fight. So we do know that the Delta variant is much more contagious, up to 1,000 times more active bacteria in the nose of a carrier than in the first phase. And, but the jury's still out on whether or not the Delta variant is worse in and of itself. There's this feeling or perception that it's attacking younger people, and of course it is, because many people over 60 have been vaccinated now. There's clear, undisputable data that a fraction of the people being hospitalized have been vaccinated. Did I say that right?
You did,
Okay.
I think. Based upon the data that is being sent to us by Monument Health.
Right, Monument and
other
Sanford and
health organizations. I think the statistic most recently here with Monument Health is of the COVID-19 patients that are in the hospital, in ICU, or on ventilators, it's equaling about 95%.
right.
Right about that number, in the high 90s, that those who are being treated for COVID-19 in Monument Health have not had the vaccine.
Right, and so that's clear. No one's making this up. And so the question is, how do we learn from that? How do we react from it? Well, the 60-plus-year-olds have been vaccinated, a good share of them. And so a couple of weeks ago, the average age of the Monument patient was about 45. So that stands to reason. It might, so I don't think there's evidence that the virus is purposely attacking younger people. It's attacking the people who have not been vaccinated. So there's a lot going on there. There's a lot to absorb, and my message is this. Now's the time to protect yourself. The chances of a government mandate to wear masks in South Dakota, anywhere in South Dakota, is absolutely 0%. That is never going to happen. And I'm not saying it shouldn't happen. I'm just saying it's not going to. It's not possible. People yell at me all the time, why aren't you putting in a mandate? Don't you care about the people? I do care about the people, and that's why I'm not going to go down that road again. Because the people hating each other and dividing is as dangerous, especially in the long term, as letting a virus go unmitigated. So it's very complicated, and it's as much a social issue as it is a public health issue. And of course, academically, that doesn't seem right. No, this is how you solve it. You put everyone in masks. You disallow every group. You shut down the non-essential businesses, so on and so forth. And then the wind blows the virus away, or whatever happens magically, and we're done. And so that's not happening. And what's happening with the schools right now, and now I know people that this has happened to. Their kids come home and have been in close contact with someone with COVID. Now the whole family gets COVID. So what's happening there is very disturbing. And there are hundreds of children who have COVID. They are taking it home to potentially thousands of family members. And there's a reason Pennington County leads the number of infections in the state. There's a reason. You can debate what the reason is, but I think there's several reasons, starting with the Sturgis Rally and all the way down to school policy. And so I'm not about to be a part of a mask mandate. That will fail every single time. I would suggest to everyone to protect yourself. Try to avoid those crowds. There were recently 15 city employees that had the virus at the same time, and in one department, and they all got it at the same wedding. So we have to be careful here, because it's not just your health. When you bring it into your family, into your workplace, to your family reunion, whatever the case is, you're putting folks at risk. And I think the nice thing, the reasonable thing to do is take care of yourself first, and thereby you inadvertently take care of other people. And I would use speed limits as an example. The government has seen fit to regulate your maximum speed on a road. And they've done that for your safety. But also, when you're driving the speed limit, it enhances the safety of everyone else on the road. And, this is a temporary condition. There's no indication that a pandemic is going to last for 50 years. This is probably the last year of the pandemic. In fact, when you look at the spike in the United Kingdom of the Delta variant, it's a huge spike. A spike and a fall in about 1 month's time frame. Of course, they have a very high percentage of vaccinated people. So my advice is also to get vaccinated. Just get vaccinated. We have a vaccination now that's been approved by the Food and Drug Administration. And by the way, many of us have had the privilege of living to the age we're at right now, in part because of government regulations. And that's the Food and Drug Administration, the CDC, everything from speed limits to food safety, to ventilation in rooms, to fire codes, you name it. There's a reason that the U.S. average age keeps going up, and it is not because everyone is eating broccoli and jogging every day. It is in large part because the environment has been made safer over time. We no longer use asbestos. Who banned it? It was the government. So, I mean, government regulations are not always bad. So that's the frustrating part of this whole pandemic, is that we're taking this personally. Like, oh, somebody wants me to wear a mask, I'm going to fight them over that. It's not a personal issue. It's a community issue. If you're going to drive the speed limit today, you're going to do it probably without thinking much about it. You could do the same to help keep yourself safe and keep your friends safe during a pandemic. So it's a big topic, and everything I say about it is wrong. Somebody wants to fight about whatever I say, which is another example why I question whether people like me should even be talking about it. But then there's still someone who would take exception with that. So it's a rough time in our history, and I think one day it's going to be the greatest, most revealing psychological study of our time on the effect of a pandemic in the modern era in the United States. And frankly, I can't wait to read it.
It will certainly be an interesting time frame in our history to study.
Yep.
Absolutely. Well, I do want to say there are a couple of comments here. Lisa Payton says, thank you for your words, Mayor. Councilmember Laura Armstrong is watching right now as well. She's saying it's about collective responsibility, and we all have to play our part for ourselves and one another. Mm-hmm. So taking care of yourself, taking care of yourself, in turn taking care of others, that's what community is about. Getting back to being empathetic and understanding with each other.
Yeah, empathy and care for each other is one thing, but also one of the lessons I've learned with traveling around a little bit is this. When you're in the airplane, the flight attendant is going through the procedures for how to get out the emergency door and what to do here and there. There's a demonstration with the face mask. When it's needed, the face mask will drop down. And secure your mask first before you try to assist someone else. Why is that? Because if you don't protect yourself, you cannot help anyone else. And so that's not a selfish thing. That's a very practical thing. You have to stay healthy to protect those around you. Likewise, if you become unhealthy because of reckless behavior, you're potentially adding to the threat of those you love around you. There's a lesson in all of this, and certainly we'll have lots of books about it and whatever in the end. But I just want the best for everybody, and you know, if you think I'm a hypocrite, I think I plead guilty to that. I'm a hypocrite just like everybody else, and but I'm doing the best I can.
doing the best that we can is what community is all about.
Yep.
And coming together when we need to.
Yep,
Mayor Allender, thank you so much.
my
For
pleasure.
joining us today on this extended version. Hey, we took about a 2-month break here, so we made up for it in one episode. Okay,
Right.
So
Sounds great.
I appreciate you stopping by today and speaking to our audience, speaking with me about things here in Rapid City.
Anytime.
And thank you for tuning in to this edition of City Beat, brought to you by the Rapid City Journal and in partnership with the City of Rapid City. I'm Nathan Thompson. We'll see you in a couple of weeks.